Goni skill, forearm supination. Position the patient sitting with shoulders 0 degrees of flexion, extension, abduction, adduction, and rotation so that the arm is close to the body. Flex the elbow to 90 degrees and support the forearm. Position the forearm midway between supination and pronation so that the thumb points toward the ceiling. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to supinate the forearm. Assess the distal end of the humerus for external rotation and adduction of the shoulder. Supinate the forearm by moving the distal radius so that the palm of the hand faces the ceiling. Make sure your force is applied proximal to the wrist so the wrist is not included in the motion of supination. Stabilize the distal end of the humerus to prevent external rotation and adduction of the shoulder. The end of supination range of motion occurs when resistance is felt and additional motion causes internal rotation and adduction of the shoulder. Assess the end feel of the joint. This is firm because of tension in the palmar radio-ulnar ligament, oblique cord, interosseous membrane, and pronator teres and quadratus muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The size and shape of a smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer medially and proximally to the ulnar styloid process. Align the stationary arm parallel to the anterior midline of the humerus. Place the movable arm across the ventral aspect of the forearm, just proximal to the styloid processes of the radius and ulna, where the forearm is most level and free of muscle bulk. The distal arm should be parallel to the styloid processes of the radius and ulna. Ask the patient to perform supination of the forearm as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the shoulder. Read the degrees of motion on the goniometer and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 80 degrees.